Those cute little ears are a big deal. They're the doorway to the brain and open up a whole world of listening, learning, and opportunity for your baby. That's why, shortly after birth, your baby receives a newborn hearing screening. If your baby didn't pass their screening, you might be left with some unanswered questions. Why did they fail? What does it mean? Do they have permanent hearing loss? I know that it may feel like a lot to take in right now, but you are not alone. We're here to help you every step of the way. And in this video, we'll share some of the reasons your little one may not have passed the screening and the chances they have a hearing loss. Hi, I'm Dr. Teresa Caraway with Hearing First. We're here to help and support families just like yours who have a child with hearing loss. We want to empower you as your child learns to listen, talk, read, and thrive just like kids with typical hearing. We've heard from many parents that after a failed newborn hearing screening, they're feeling like they have more questions than answers. You may even doubt the results, especially if no one in your family has a hearing loss. Taking your baby for a complete hearing test is the best way to find out the status of your baby's hearing. And you might be asking, what does a failed newborn hearing screening mean? Or what are the chances my baby has permanent hearing loss? That seems like a really simple question and one you might be eager to hear the answer, but it's actually a little complicated. And in this video, we're going to give you as much information as we can so you feel equipped, empowered, and prepared for your next steps. I'd like to introduce you to my friend and colleague, Dr. Jace Wolf. He's a pediatric audiologist with over 25 years of experience working with babies and young children who are deaf or hard of hearing. He's going to explain more about the results of the newborn hearing screening.
Hi, I'm Dr. Jace Wolf. So first of all, what parents need to know is that there are a number of factors that influence the results of a newborn hearing screening. In the next few minutes, let's unpack some of the common factors behind a failed screening and what it could mean. Of course, it's possible that the baby may have permanent hearing loss. Hearing loss is the most common disability present at birth, with about 3 out of every 1,000 babies born with a hearing loss. Now, I'm definitely not saying this to scare you, but I want you to know that hearing loss can be relatively common in newborns. So while there is a chance they have permanent hearing loss, it's also possible their hearing is totally fine. You may be wondering, well, if that's true, then why did they fail? That can be for several reasons. For example, a baby must be very still and quiet during the hearing screening, ideally sleeping soundly. If a baby is restless, moving, or being noisy during testing, it's likely the newborn hearing screening will not be successful. Or if the environment is noisy, the newborn hearing screening results might be affected by the background noise. Another reason could be fluid from birth in their ears. Babies are born with fluid that can accumulate in the ear canals or behind the eardrum. That could prevent the test signals from reaching your baby's ears or make certain types of ear responses hard to detect during the screening. These fluids are often gone after the first 24 to 48 hours after birth. It's possible that after a few days, your baby may pass a newborn hearing screening if fluid is why they initially failed. The timing of the newborn hearing screening is another big factor. Many babies only stay in the hospital for a day or two after they're born, so we want to do the screening before they go home. But due to fluid buildup that we just talked about, there's a better chance that a baby will fail the screening if it's conducted during the first 12 hours after birth. In other words, we need to do the screening before mom and baby go home, but we also can't be in too much of a rush to get it done immediately. One study found that conducting the screening 24 hours after birth decreased the chances of failure by 50% compared to 12 hours after birth. Most newborn hearing screening programs try to complete the first hearing screening between 24 to 36 hours after birth. Did you notice I said first hearing screening? That's because your baby may have had more than one hearing screening. In many hospitals, the newborn hearing screeners attempt to complete one screening about 24 to 36 hours after birth, and if the baby doesn't pass that screening, then another screening is completed right before the baby leaves the hospital. In some cases, you may be called back to the hospital for an outpatient hearing screening. This is usually the same screening that happens after birth, but it gives your baby a few more days for fluid to clear from their ears. Another thing that can influence the results of a hearing screening is the health of the baby. Several risk factors are well known to increase the chances a baby has hearing loss. These factors include, but are not limited to, more than 5 days in the neonatal intensive care unit or the NICU, a low birth weight, or a family history of childhood hearing loss. Infants with these risk factors are up to 10 times more likely to have hearing loss after failing a hearing screening than a baby with no risk factors. Because babies with some of these risk factors are more likely to have a permanent hearing loss, multiple hearing screenings are not recommended. In other words, if a baby with hearing loss risk factors fails the first screening, they should immediately be referred for diagnostic testing. Why? Because there's not a moment to waste to identify hearing loss and to take action to help them start hearing all the sounds around them that their little brain needs.
Hopefully, this explanation helps you understand why it's not easy to say for certain what the chances are of a permanent hearing loss after a failed newborn hearing screening. There are many different factors, but the takeaway from this video is that urgent action is critical for your baby's little brain if they fail their hearing screening. There is a chance they don't have permanent hearing loss, but you need to know for certain. Make sure you follow up with your pediatrician or pediatric audiologist to schedule a complete hearing evaluation in the first 1 to 3 months after birth. We have some helpful videos about how a baby's hearing is tested linked below for you. Your baby's overall development and their bright future depends on you acting quickly. Wherever you are on this journey and however you may be feeling, you are not alone. Hearing First is here to help you every step of the way. Sign up for emails from Hearing First to learn more about this journey, and be sure to subscribe to the YouTube channel for new videos with tips and advice. For more resources and support, visit hearingfirst.org.